All right, I'm going to start if that's fine with everyone. I'm Danielle Angelari. I'm the executive director of NAMI Northern Illinois, which is the National Alliance on Mental Illness. We're dedicated to improving the lives of people living with mental illness and their families through support, education, advocacy, and hope. And I want to thank you all for joining us. And I just want to give you a little housekeeping stuff. So I would ask if you could hold your questions till the end, and then when we get to that point, if you would be so kind to put the questions into the chat box, just so we have some control over like sound and things like that. And I will ask the questions then to our presenter. And then at the very end, there is an evaluation that you can do electronically if you'd stay with us to kind of wrap up on that side. So I'm going to turn it over to Mary W. Lee and let her introduce herself really quick.
Okay, thank you, everyone. And I wanted to add one other thing to housekeeping. If you'd be so kind to go in the bottom left-hand corner and turn off your video, because right now I'm seeing all of you, but I can't see my own PowerPoint screen. Thank you so much for letting me meet with you folks today. It's just my privilege to be here. I so respect the work that you do. I don't know how we would get through this pandemic even without you. So you folks are really among my heroes, and thank you so much for letting us share today. I think it's important to talk about trauma, especially at a time like this. And I'm going to go through several things with you, talk about what is trauma, what effects does it have, and then what are some things that we could do to build resilience within ourselves if we are affected by trauma too. So I am, again, Mary W. Lee. I am a licensed clinical professional counselor and a licensed social worker. My job right now is I am a training consultant, so I provide training and technical assistance all over the state of Illinois. But I most enjoy doing these kinds of trainings also with NAMI. I have been a NAMI member since NAMI started here in Northern Illinois. So why even talk about trauma? Why bring that up? Well, I think right now the timing is great, again, for a pandemic, but I think we should talk about trauma regardless of the pandemic, and that's because the rates of trauma are very, very high. These are kind of boring statistics, and what I'd like to do, and I can get them to Julie, is I have a one card stock paper that's 8 by 10 that's two-sided that actually is a good summary of this whole presentation for you. So I'd like to get those out to you. I think you'll probably like that more than having copies of the slides, although you're welcome to ask for copies of the slides if you would like to. So these are some statistics. I'm not going to read them all to you. You can read them yourselves, but you can see how high these are. And some specific groups, especially the differences in the percentages between men and women, and also our returning veterans. What is trauma? Well, this is something I really had a dose of humility with, because I went through SAMHSA, the federal government's training to be a trauma-informed trainer. And when I went through the training, I went through both the beginning and the advanced. I had to rethink what the definition of trauma was, because I always thought trauma was something that happened to you, and it's much more involved than that. So here's a good definition, a kind of a long one, but I like to break it into 3 different words. You have the event, but then everyone experiences it differently. And because of that, it has a different effect on all of us. So it's really a combination of the 3 E's. You have the event, you have the experience, and it takes its effect on you. So primary trauma is where we're going to start out today. So primary trauma can happen to anybody, whether or not it happens to you directly or you watch it happening to somebody else. So these are the traumas that we'll talk about: assault, abuse, being threatened even with being hurt, being stalked, being bullied. And of course, this is one we know is really on the rise right now in our country and in our culture. Being accused of doing something you didn't do. Witnessing it, trauma happening to somebody else. We also have some natural traumas like hurricanes, like tornadoes, but we have man-made disasters, things like 9/11. And of course, we have things going on right now like our pandemics, definitely a primary trauma. So it starts out with this traumatic event, and the trauma really overwhelms the person both physically and psychologically. And I have some good slides that'll help you understand this a little bit better. But our brain has to decide what it's going to do. Are we going to fight it? Are we going to run from it? Are we going to freeze and do nothing? After we've been traumatized, our brain changes. There are really specific changes in the brain that I will show you some PET scans of as well. In addition to the physical changes in our brain, it also causes physical distress. And these things can reoccur with triggers. If we have a trigger of something that happened to us in the past, it's going to bring us right back into that trauma again. And then, of course, we have both the emotional and the physical responses that are not only immediate to the trauma, but can really last for a long, long time. So trauma really plays a serious part in probably at least 3 of the serious mental illnesses that we work with all the time with NAMI. One, of course, is depression. Depression is definitely a result of trauma. So these are PET scans. And if you see all the light up stuff, that's your brain chemistry. Those are your neurotransmitters. So of course, we have everything kind of lit up on the left-hand side, someone who does not have depression, as opposed to, boy, it's pretty bleak, right? And it's pretty quiet, it's pretty dull on the brain that has depression. Doesn't have all of that chemistry going on. The next of the serious mental illnesses that, of course, is a result of trauma is post-traumatic stress disorder. And if you look at the brain on your left, which we call the healthy brain, somebody who does not have post-traumatic stress disorder, see how it's all lit up on those 2 red spots in the beginning, right there? Well, that is right there in the beginning. That's what we call your prefrontal cortex. And this is why we have this part of our skull is one of the strongest bones that we have, because it needs to protect what goes on in that prefrontal cortex. Because that's where we make our decisions, that's where we get things done, that's how we line things up, that's how we pay attention. But look at what the brain looks like for someone who's been traumatized and now has post-traumatic stress disorder. The light ups in the brain are everywhere in the brain. The person is constantly on the vigilance, right? We call it being hypervigilant. Everything's going on, has to be taken care of. Everything has to be on the alert. So this picture here is a really good one of the brain, and look at what's hidden right here. There's a little teeny circle right here that's called the amygdala. And it's buried in your brain for a reason, because it is so, so important to what we do. It's really in charge of taking things that happen to us and making a decision about what we do and balancing out those feelings with those thoughts. So it's very, very buried, but it's very, very powerful. So let me give you an example of how this amygdala works. Think of an average person. It's sometime in July, and all of a sudden you hear bam, 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 okay? Well, what are you gonna do about that? So you have this threat, okay? And the threat goes right to that amygdala. That amygdala now has to decide, what am I gonna tell my brainstem to do? Am I gonna fight, flight, or freeze? Listen, I'm going to send these neurotransmitters up to that prefrontal cortex, which will help me decide, is it going to be fight, flight, or freeze? So the decision making goes up there. The prefrontal cortex says, hey, not to worry. It's 4th of July. Those aren't gunshots. That's not gunfire. That's just simply 4th of July fireworks. Now think of somebody, for example, a returning veteran or somebody who has been through a horrific gun shooting and how it might work with them. So the next slide will show us, again, we hear the bam, 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 and it's going to trigger that amygdala. That amygdala now has to decide, what am I going to tell my brainstem? Are we going to fight, flight, or freeze? Well, before we make that decision, let's set it up to the prefrontal cortex and let's make up our minds. And guess what? That prefrontal cortex isn't working, because just like the picture I showed you of the brain, those neurotransmitters are now everywhere. They're not where they're supposed to be, where we have our decision making. So now we have a serious trigger of the trauma. Another serious illness that is so affected by trauma, and is now called a trauma-related disorder, is obsessive compulsive disorder. We know now that this disorder is caused by previous trauma. So look at this particular slide here. You have the normal brain, person who doesn't have obsessive compulsive disorder on the left-hand side. And then you have the obsessive compulsive disorder on the right-hand side. See all that stuff firing up again in that prefrontal cortex? Because that person, again, is always on the alert. I better plan, I better organize, I better get things done, everything better be perfect, I better line up all my ducks. So there is so much going on there, it's overwhelming to the person. So those three are the most serious of the mental illnesses that we see: the post-traumatic stress disorder, the depression, and of course, obsessive compulsive disorder. But in addition to those, we also have what we call emotional and physical responses to the trauma. Some people literally run away from it. And by running away, it could be physically running away, like isolating yourself, but it also could be going off to la la land. We call that dissociation, being depressed, being anxious. Some people respond physically by harming themselves, using substances, having an eating disorder, being suicidal. And some people have the physical response of harming other people. We know, especially with things like depression, women tend to turn things in, men tend to turn things outward. So people have to decide, am I going to be the predator or am I going to be the prey? And now we have all the data that proves, in addition, we also have physical health problems for people who have been traumatized. Now, the interesting thing is everyone's different, right? We all came from a different place. We all came from a different upbringing. Even if we have siblings, we were all raised differently because different things happen to us. So every single person is different depending on what they bring to the table, so to speak. So it really depends. Was this a trauma that happened many times? Was it reoccurring? Did they already have existing health problems? What kind of coping mechanism do they have? Have they been able to build some resistance? And again, do they have to fight with that decision? Am I going to be a predator or prey? Other things that might affect that person of negative behaviors would be, again, substance use, violence, predator or prey. Also could be just not being able to cope with that trauma. And we do know that punishing people that have been traumatized actually hurts more than helps. So what makes one person more vulnerable than another? How severe was it? How close was it? Did it happen to you, or did you see it happening to somebody else? And if you saw it happen to somebody else, how close were you to that particular person? I think one of the stories that I like to share when I do this is I experienced some trauma myself right in the parking lot of Schnucks grocery store. This happened about 2 years ago in the middle of a Saturday afternoon, broad daylight. We were all pushing our little carts out to our cars, and all of a sudden some gentleman with a gun came up to a woman who was very close to me. She couldn't have been 10 feet away putting groceries in her car, and took out his gun to rob her. Now, everybody was particularly traumatized. Thank goodness most people have cell phones. Many people took pictures, and of course we called 911. And thank goodness that gentleman was caught. It was kind of silly to do that out in public because everybody did get his picture. Just think of that woman that it happened to. So she was the real victim, right? She had the gun in her face. We all watched it happening. It was serious to us too. And I'll tell you, to this day forward, I will always be clasping onto my purse, or maybe not even bringing a purse into the parking lot over at Schnucks. Another thing that helps people be vulnerable is if you already have a mental health problem, you already have a mental illness, you're already struggling with that, that's going to make you more vulnerable as well. What if it's more than one trauma, more than one event? I mean, one car accident is probably not going to be as traumatic as being raped over and over again. If you have a physical health problem, you're not going to be able to fight this off as well. And what if you don't have those coping skills? What I like to think about is what can we do as a community to be more positive? What can we do to build the resistance, both in ourselves and our entire community? Because our goal is for all of Winnebago County to become a trauma-informed community. So we know people are more resilient if they have close family ties. How close are they to their family? And remember, when I say family, that's not necessarily mother, father, sister, brother. That's who you're going to celebrate Christmas or Thanksgiving with. Do you have a strong primary relationship? Do you have a best friend? Who can you call when you're feeling down and out? Who can you tell your troubles to? Who's always there for you? How connected do you feel you are to the community? Do you really feel like you belong? Are you a part of this? Do you maybe even have some power or some input? Do you even vote? Do you have a job? And maybe if it's not a paid job, do you at least have something that makes you feel like you're accomplishing something, some other meaningful activity? And of course, are we culturally connected? What is our culture? Do we understand it? Do we embrace it? And do we have any religious beliefs? Are we tied to a faith-based community? We know all of those things help with resilience. So after someone's been traumatized, some of these things happen to them right away. These would be the early responses. People do not sleep well. And if they're able to get some sleep, they probably wake up with nightmares or night terrors. They have what we call an exaggerated startle reflex. Okay, again, they're always on the watch. They're restless, they're hyperactive, they're hypervigilant. They feel like they've totally lost control, and they're going to be more sensitive to everything from light and smell and touch, really feel like they're kind of losing their mind. And again, they look for alcohol and other drugs because they work. It makes you feel better. If the trauma is not treated, these are some of the later responses to the trauma. Having cravings, again, alcohol and other drugs, being just totally exhausted, and all of a sudden now having all kinds of physical problems. This hurts, that hurts, the other hurts. Eating disorders, and not being able to make a commitment. I don't know what's going to happen. I don't trust what's going to happen. I don't trust you. Again, being depressed and isolated and not being able to make those decisions. So those are what we're talking about, the results of primary trauma. It happened to you, or you saw it happening to somebody else. There's also secondary trauma, which is why I was just so grateful to get a call from you folks to come and talk to you, because I'm concerned about you experiencing the secondary trauma. Because this is for people that now are really experiencing trauma through what other people are telling them, through what other people are sharing with them. And I'm going to venture to guess that most of the clientele that you work with at RAMP have experienced some trauma in their lifetime. Secondary trauma is actually now a diagnosable mental illness. So we social workers, we have this diagnostic and statistical manual that tells us how to diagnose people, and it's actually listed in there now as a diagnosis. Experiencing repeated or extreme exposure to adverse details of the traumatic event. So listening to other people tell you about their trauma. So again, this might be somebody's telling you what was happened to them, the violence, the injury, even death. Now we have to really kind of sort out some of these different conditions, because sometimes people get them kind of confused. There is a compassion fatigue, okay? That is definitely one here you can see that's pretty well defined. There's the vicarious trauma. Again, it didn't happen to you, but you saw it happen to somebody else. Compassion satisfaction, okay? You actually get positive feelings for doing what you do, and I hope that happens to you in your job here. But then, of course, there's also burnout. You are totally exhausted, okay? And it develops as being just totally under stress. And it really is not necessarily due to experiencing trauma. So here are some good definitions. Again, compassion satisfaction, that's good. It's part of the helping profession. This is why you got into the work that you're doing. But compassion fatigue now has a negative aspect of you, a negative impact for you as a helper because of you dealing with traumatized people. Of course, being totally overwhelmed and thinking about leaving, or maybe just not even performing well at work, is burnout. And then there's work-related traumatic stress, okay? You could have a trauma that you experience through work. So secondary trauma is definitely very prevalent as well. We're talking about, depending on where you get the data from, anywhere to from 40 to 85% of the helping professionals, all right? They study specifically social workers, but also substance use counselors as well. So what are some of the warning signs of the secondary trauma? Again, problems with sleep. If you can't sleep, nightmares, night terrors, being angry, getting kind of disgusted, not being able to concentrate, yourself being hypervigilant, just being exhausted, and then being overly preoccupied with trauma. You can have these intrusive thoughts that keep coming into your head, and then you start to wonder, where is my God in all of this? If you are a religious person, have I been abandoned? And of course, using alcohol and other drugs because they work. We would really like to start screening more people for trauma. And I'm going to talk to you today about 2 important screening tools. Now, when I use the word screening, it's not a test, it's a screening. It's a yes or no. Maybe it's a red flag. It's going to help you determine if there is a problem. It is not a full-blown assessment. One of the most effective screening tools that we have is called the Adverse Childhood Experiences Scales, or the ACEs. It's a simple list of 10 questions that you ask. Again, you just answer yes or no. And the ACEs are going to really determine all these other problems that could happen to you. So think of the different types of adverse childhood experiences are out there. We have abuse. We're talking about physical abuse, emotional abuse, sexual abuse. Also have neglect. It could be physical or emotional. But also another adverse childhood experience would be household dysfunction. Is there mental illness in the family? Is there substance abuse in the family? Has someone been to prison? Is the mother treated violently, and have the parents gotten divorced? Now, the ACEs are only to talk about childhood experiences, meaning what happened to a person 18 years of age or younger. You could still have this screening done when you're 50, but it only talks about what happened to you 18 years and younger. ACEs, we know, higher the score, the increase in the health risk. And we've got so much data right now. And by the way, these are all from the Center for Disease Control if you want to check them out. What do ACEs also increase? Everything from loss of physical activity to alcoholism to smoking to cancer to diabetes. So again, if we don't address these adverse childhood experiences as soon as we can, this is what that person has to look forward to later on in life. So I'd like you all to take just a couple minutes with me and take the ACEs screening yourself. Just use your fingers, count how many yeses you have, okay? So let's start out with the first one. Did a parent or other adult swear, put you down, or humiliate you? Yes or no? Did a parent or other adult push you, grab you, slap you, throw something at you? Yes or no? Did a parent or older person touch you, fondle you, or have you touch their body sexually? Yes or no? Do you think no one loved you or thought you were special? Yes or no? Did you not have enough to eat, wear dirty clothes, or had no one to protect you? Yes or no? Were your parents separated or divorced? Yes or no? Was your mother or stepmother pushed, grabbed, slapped, kicked, or bitten? Yes or no? Was anyone in the household an alcoholic or an addict? Yes or no? Was anyone in the household depressed, mentally ill, or committed suicide? Yes or no? Did anyone go to prison in your household? Yes or no? So just count out in your head, we don't expect you to share this with other people, how many yeses you have. And think now again, just with yourself, we don't want you to share this with other people. What do you think is an average ACEs score, which is the number of yeses? Well, first of all, remember, childhood trauma is very common. It doesn't make any difference about how rich you are, how poor you are, how educated you are, where you live. But we do know that there is a definite link between childhood trauma and adult chronic diseases. And we also know, of course, it's going to cause those serious emotional problems. Most people who have been traumatized did not just experience one traumatic event. It's usually several things. Now, think of your ACE score. How many yeses did you have? The higher the ACE score, the higher the risk for disease. An ACE score of 4 or more means you really need to get help. You really need to talk to someone. An ACE score of 2 really is very common in our country, and that's because of the high rates of mental illness, substance abuse, and divorce. If 50% of our marriages are ending in divorce in our culture, then of course we know that people are going to have a high chance of having that one number. But again, 2 is average. 2 really is common. But 4 or more means you really need to get some help. We also know that people with high ACEs scores also get involved with the criminal justice system and become very serious IV users, IV drug users. We talked a little bit about how trauma can also impact depression. And again, we've talked about women tend to turn things in, men tend to turn things out. Well, this is a slide that just shows that, how it goes up higher and higher, the rates of depression with the higher the ACE score. So again, those questions are for people of what they experienced 18 and younger. There is another PTSD screening that is for people that have experienced it after they were 18. Probably the easiest and fastest, and I will say cheapest, by the way, these are all documents that are free. They don't cost anything to download, and they're very, very usable, okay? This one we were hoping, they call it the primary care PTSD screening, would we find it more commonly in doctors' offices? Because this is just really 4 simple questions. In your life, have you ever had any experience of any of these things? Had nightmares or thought about it when you didn't want to? Tried hard not to think about it or went out of your way? Were constantly on guard, watchful, or easily started? Felt numb or detached from others, activities, or even your surroundings. So in this particular case, with the primary care PTSD screening for adults, just one would be enough to say you need to get some help. We'll get back to questions on that later. So what do we want to do to be proactive? What do we want to do to be positive? Again, we really need to help develop resiliency with the people that we work with, ourselves and our clients. So for individuals, for people, make healthy choices. That's what you eat and how you sleep and how are you socially involved, and to really come up with a good action plan. Organizations could also develop resiliency. So an organization like RAMP, do they have realistic training about trauma? Do they plan on it? Do they have written guidelines? And what resources do they have set up for their employees? Do they have an EAP program? How about peer support? Or is there maybe a designated safe area, that you could go to? Other strategies for developing resiliency for individuals, look and see, this is not normal, okay? Get some help. Try not to use alcohol and other drugs to treat it. Using things like mindfulness and spirituality to get through it. Organizations, again, they can work on things too. Remove the threat, make help available. Have some emergency procedures. And if something does happen at the agency or organization, make sure that there is a critical incident debriefing. So whether it's with one employee that this happened to or a group of employees, you need to sit down and talk about it and do a debriefing after the event. Again, resiliency, we've already talked about, you need those family and friends, right? You need somebody to go to. But you also need to work on being a helper yourself. We know that that makes you feel good. And having some hobbies, using your own mindfulness and spirituality. And there are things that an organization can do too to build resiliency. Be out there in the community, have events, be sure you communicate. If you had something happen as an organization, it's lessons learned. and use everything as an opportunity to do better in the future. Now, what about people who have been traumatized? What can work with them? And actually, these things help people with just day-to-day lives. So we have to take care of ourselves physically. And that means we need to eat regularly and eat healthy, okay? Exercise, get some sleep. If you have a medical problem, make sure you get attention. And if you're sick, stay home. If you can, get a massage. Of course, you can't do that right now. But also find some other physical activities that are fun for you. Take a vacation, even if it's just a walk through the forest preserve, and try to get away from that technology. We just can't sit there and listen to CNN all day about what's going on with the coronavirus. And also stay away from things like Facebook, Twitter, and the regular news as well. We need to take care of ourselves emotionally. Be with people, not only who that you like, but you know like you, all right? So stay in contact with the important people in your life. Don't let something like this coronavirus keep you away from your family and friends. Be kind to yourself, be proud. Maybe you need to keep a journal and make notes of, gee, what have I gotten accomplished? And you know, crying is okay. It does actually release tension and lowers our blood pressure. But we also need to take care of ourselves spiritually, whatever works. There's so many things out there, from prayer and meditation and reflection to just spending time in nature. And what a beautiful time of year we have to do that. Participate in a spiritual gathering. Again, it's got to be 10 or less right now, or on Zoom. Look at some of the non-tangible aspects of your life and express gratitude. And even if that means just putting pen to paper once a day saying, this is what I'm grateful for today. Singing is great. We also know that lowers your blood pressure. Okay. Read inspirational literature, listen to music. There's some things we could do in the workplace, okay? The physical and the virtual workplace right now. Take time to talk with each other. And that's got to be a lot harder and more challenging, especially when you're not all in the same place anymore. Find the meaning and the value in your work. Check things with your supervisor. Consult with other people. Figure out, even if you're working from home, how do you transition from I was working and I'm not working anymore? There has to be a transition so that you know that you've literally turned that switch off. And of course, if you have been traumatized, where do you go? Do you have an employee assistance program? We all experience stress, and even if it's not traumatic stress, we all have to deal with stress. So let me just give you a couple of ideas here of things we could do that are quick, that help us reduce stress. So even if you just take a minute, breathing is the number one. It's like in through the nose, out through the mouth, okay? Just do that 10 times, and believe me, you will feel so much more calm. Stretching, and even if you're sitting in a chair, you can still stretch your feet. You can still stretch your toes. It's okay to daydream. You can do that. Laughing is great. Doodling is great. Complimenting yourself or just looking out the window. If you can spare 4 or 5 minutes, then you get into music or talk to somebody. Have a healthy snack or take a short walk. What if you have 10 minutes? Even better yet. Okay, again, journal. Have a longer conversation with a friend or family or loved one. Tidy up your room. It might not be fun, but it sure does make you feel better. Read something. Listen to some soothing sounds. Play a game. And if you can get a whole half hour, get a massage. Right now, probably would only be somebody that you live with. Definitely exercise. Eat lunch with others. It could even be lunch on Zoom. Go shopping. It's probably going to be online right now. Watch some TV show, watch something that's fun, or even listen to a podcast. And believe it or not, we could use all of our 5 senses to help us cope with stress. There are certain things that we know physically will help us de-stress. One is, as you can see here in the column, all the things that you can taste. There's everything from chocolate, which is very good for you, plus it has dopamine in it, which you need. Green tea, chocolate, mango, milk, celery, bananas, all of those are good for de-stress. There are certain smells also that help us relax and calm down. Things like lavender, eucalyptus, even coconut. People often use different sounds to help them relax and deal with stress. And some things you can even get as apps on your computer or your cell phone. The rustling of the leaves or the streaming of water, hearing the waves come in and out, maybe just having a fan going or some white noise often helps people. Touch. Play-Doh, having those wonderful little stress balls that we have, even using rubber bands and bean bags, or even just needing an eraser. And then there are certain sites too that we could use to help us calm down and relax. Who doesn't love to see darling little babies or animals, and especially baby animals? So there's all kinds of things that we could use to put up there as sites for ourselves. So I'd like to open it up for questions. I did get a couple of questions in advance. Hopefully one was kind of answered throughout the presentation, but one was specifically asked about, gee, are there some good podcasts out there about trauma? And I'm so excited to tell you that if you go to the NAMI Northern Illinois website, there is a recent manual that was put up there about how to deal with stress and with this pandemic. And one section of that are just all the good podcasts that are out there now to help deal with stress. So are there any other questions? If you want to feed them to Danielle, she would be happy to bring them up. I know this is a lot of information in a short time.
All right. How do you know if it's trauma versus a lack of good coping skills, or is that the same thing?
Well, a good question. Thank you. So a lack of coping skills is going to make you vulnerable for trauma. So if you have a traumatic event happen to you and you don't have the coping skills, then you are going to be more traumatized. So we really need to work with people and teach them these coping skills. We have to learn them ourselves, okay, so that we can work in the helping profession, but we have to teach those coping skills to our clients who we know are experiencing stress.
What did you mean when you said a safe area at work? Or
some agencies and organizations have done a really interesting combination of things. One of the things that I see is that one of the things that helps with stress, by the way, is what they call rhythmic repetitive behaviors. Just like a mom rocking her baby, we know that rocking actually helps us calm down. I have seen many places that now put rocking chairs in their waiting rooms or put rocking chairs in their office where people get therapy. But if you want a whole safe area, there could be a place where a staff person could go to that's beyond the staff lounge. It's quiet, it's serene. It might have some of that calming music playing. It might have some literature out there that's more inspirational and not just your everyday magazines. So a safe place where staff can go to feel calm, relaxed, just to take their break, just to have a few minutes of time.
how could or should we use ACEs scores with our consumers? Do we need to be trained to do this?
Excellent question about the ACEs score. Remember, the ACEs is a screening and it's a self-screening. So you don't need any training to do it. The person doesn't need any training to do it. They might have difficulty reading, so you might have to read them the questions, just like I did for you today, but it's something that a person does for themselves. Now, I have a personal and professional dream, and that's that we start doing the ACEs pervasively throughout the entire Winnebago County area. And I know you serve multiple counties too. So I have a dream that we will start doing that in physicians' offices, in the pediatrician's office, and in school systems. I think it's very important that we try to get people as young as we can. However, if you're working with adults, you could still use that same screening tool for them, because if they have not been treated for the trauma, they are headed for all those serious physical problems, in addition to the mental and emotional problems. So you can download an ACEs. It's just a PDF thing with the 10 questions on it. Just Google it, download it for free. A community mental health center, an establishment like Rosecrans, has actually built those questions into their assessment tool. So a screening, again, is a once over lightly, yes or no, red flag or not, and the person screens themselves. If they screen themselves and they have an ACE score of more than 4, then they need to have a full assessment by a professional person.
How do we insulate ourselves emotionally and mentally from hearing the trauma of our consumers over and over?
Good question. This was, I think, one of the ones that I got in advance. So if you are working with a person who has been traumatized and they have not been treated for the trauma, they need to go for treatment. So unless you are a trauma-informed counselor or a trauma-informed and trained therapist, you need to refer them to somebody who is. There are certain techniques that are used in therapy to deal with people who have been traumatized. And there's a big difference between being a trauma specialist therapist and just a counselor, okay? So if that person needs to talk about it and hasn't gotten a treatment, you need to refer them for treatment.
What are healthy ways to practice coping skills while working?
Okay, good question about the coping skills while working. I think if you take a look at the different ones that I had listed, try to incorporate them into your work area, okay? So whether it's not at the end of the day, you make a note of this is what I got accomplished today, or this is what I'm proud of myself for today. Or this is something that a problem I had to deal with and how I dealt with it today. So if you summarize your day at the end of the day, give yourself a pat on the back, maybe reach out and talk to somebody that you can share it with. Those are some good work-related coping mechanisms. Another good coping mechanism for work, again, and it's tricky because you're working from home, is how do you end your work? Okay, how do you turn off that switch? Because you have to. At some point, work is done and you have to get on with your personal life. So there are just a few things that we mentioned, but we would be happy to get you all copies of that PowerPoint if you want to take a look at some of the other things that you could do, whether it's 2 minutes of time, 10 minutes of time, or 30 minutes of time.
A follow-up to the question about insulating themselves emotionally and mentally. They're just asking what could they do with the things that they're told. So how do they protect themselves from the secondary trauma?
Again, I think to protect yourself from the things that you're being told is to set some limits and boundaries. When you're dealing with a client and you're getting to know them, you're maybe doing some history with them, you're putting together your own assessment with them, yes, you should listen and shall be told. But to be told over and over again is not healthy for you, and it's not healthy for that person. Once you have that red flag of the 4 or more ACEs, they need to be referred to a trauma therapist. So at that time, you have to set some boundaries and limits and let them know, gee, I hear what's happening to you. It must be really, really harmful for you. Let me get you some help. Let me get you to a person that you can talk with about that. But you got to set some boundaries. You have to take care of yourself.
How about when it's not trauma specific, but if it's just like really sad or tough to hear, how do you like prevent yourself from being dragged down by it?
Well, after working in social work for a very, very long time, I can certainly relate to that. I've had to deal with everything from suicide of a client to losing clients in other ways, to horrible pitfalls with people. And you know, it's okay to feel. It's okay to cry if it's really sad. It's okay to worry. It's okay to wonder, gee, did I did the best thing? But then again, it's very okay to bring in those coping mechanisms. Who do you have to tell your troubles to? Where do you go? Do you have it set up where you can actually get some help or some support from a supervisor or for a coworker? Putting all that together as a package.
Do we have any more questions?
So Danielle, do you have the addresses for all the folks who attended today? Email
I don't-
addresses?
I believe I do if they signed up on here. Otherwise, I can send to Julie and she maybe could distribute.
That would be great, because the last several pages of that would really help people with the suggestions of the coping. You know, what are the ways to cope with this? All the things that you can do. And I'll try to find a way to get Julie also that one-page handout just on trauma.
Yes, and everyone says thank you. And I am going to give the recording of this to Julie as well, so she can send to the rest of her staff that wasn't able to make it today.
Okay, and we would really wish that you could give us some feedback about how this went today.
Oh yeah,
Obviously, we're a little new in the Zoom world, so I think Danielle is going to send out a little poll to you folks, which we consider like an evaluation. So if you could please take a minute and complete that for us, it would be really helpful. But thank you so much for giving us your time today. I just so respect what you folks do, and keep up the good work that you do. Thank you.
Yeah, so here's the first poll, and then I do have a second one when you guys are finished with this one. Should be pretty quick and painless. Any final thoughts, Mary, while everyone's polling?
No, I just, I think that the work that you folks do is so admirable, and even in times when we have a regular calm world, so you have to really work hard at taking care of yourselves during this pandemic, because there's so many other stressors it's brought to us, and made it even so much more difficult to reach out to family members and friends and supporters. But you can do it. You've got this. Danielle, maybe you could tell them the name of that guide that's on the website too, the actual name for it, so they can find out about the podcasts.
Yeah, it's called Maintain Your Mind. And it should be like right on the front page of our website when you go to it. And that's NAMINorthernIllinois.org. It looks like a couple more people are finishing up, and then I'll switch it to the next one. Or maybe you're done. All right. Oh, never mind. All right, I'm going to switch over if that's okay with everyone. And then whenever you're done, feel free to log out, and thank you guys again for coming today. Take care of yourselves.